Hi there again, I'm Dr. Caire and welcome to another episode of ToothsDay Truths, where I answer your questions on dental care based on my 40 years of experience. If you're enjoying these videos, please take a moment to subscribe to this channel. It's easy to do. Just hit the button below. Today we have a question from Wilbur Scrudd. You may remember Wilbur as the husband of Lurleen Scrudd from our bleaching video. Wilbur, what's your question?
Yup. My dentist says I got Rosie O'Donnell disease. What's that all about?
Rosie O'Donnell disease? I'm sorry, I don't know what that is. Did your dentist say anything else?
Yup. Said I got bad gums.
Oh, that's periodontal disease, not Rosie O'Donnell disease.
You telling me Rosie O'Donnell got a brother named Perry? Well, I ain't never met neither one of them, so I don't know how I got his disease.
No, Wilbur. Periodontal disease is an infection of your gums. You usually get it by not cleaning your teeth properly and not visiting your dentist regularly. Do you see your dentist regularly?
Sure do. Go every 6 years, just like they tell me.
6 years? I'm pretty sure that's supposed to be 6 months, not 6 years.
6 months? Why, I don't even change my underwear every 6 months. Why I gotta go to the dentist every 6 months?
Well, it's not 6 months for everybody. It depends on each individual case. But let me start by giving you a little background on periodontal disease. First, let's get some terminology out of the way.
Just a minute there. You ain't gonna terminate nobody, especially me.
Not terminate, terminology. Words. Look, just listen for a while and I'll explain. Here's a drawing of a tooth. It shows the enamel on the outside, the dentin below that, and the pulp or nerve and blood tissue in the center. Periodontal means around the teeth, specifically the gingiva and the bone. Gingiva is just a fancy dental word for gums. So, periodontal disease is an infection of the bone and the gums around the teeth.
Okay then, no problem. I'll just take me some of them antibiotics and clear up the infection, then go see my dentist every 6 years.
Well, Wilbur, it's not that easy. You see, antibiotics alone won't get rid of what's causing the disease. Just hang in there a little while longer and I'll explain. So around each of our teeth, there's this little ditch, a ditch we refer to as the periodontal pocket. As we're having a fun time living the life and enjoying ourselves, the bacteria in our mouths join forces and secretly attach themselves to our teeth with a sticky substance called plaque. They do this all over our teeth, but when we brush and floss, we get rid of most of it. Unless they're hiding in that little ditch around our teeth. If we don't get our toothbrush and floss to the bottom of the ditch, they get to live there rent-free. And like the ne'er-do-wells they are, they start inviting their friends over. And they start to build calculus, or tartar, which is essentially a little bacteria condo development. So while the sticky plaque they were living in was like a tent city that could be wiped out by a toothbrush, now they have a sturdy structure that can't be budged easily. So they invite more and more of their friends over, and that little ditch around your teeth becomes party central. And their friends start building more and more bacteria condos. Now their neighbors, the gums and the bone, don't like these little jerks that have moved in next door. The gums get angry and turn red and puffy, but the bone is more timid and decides it'll just move out of the neighborhood. As the bone moves away, the ditch deepens, which allows room for more and more bacteria to move in, making it more and more difficult to evict them and to restore peace to the neighborhood. Now, we know from science that when used effectively, a toothbrush and floss can go as far down as 3 millimeters into that ditch. So when you go to the dentist or dental hygienist will actually measure the depth of the ditch. If it's less than 3 millimeters, you're okay and can continue brushing and flossing to keep the ditch clean. But if the ditch is 4 millimeters or deeper, you're going to need professional help to clean out the bacteria at the bottom of the ditch. That professional help is usually referred to as scaling and root planing. And it's important to make sure it gets cleaned out, because as long as the bacteria are living there, The bone is moving out. Once enough of the bone is lost, the teeth will get loose and leave the neighborhood as well. And in a nutshell, that's what periodontal disease is. The science is more complicated, and there are a lot of other factors that are involved, but you get the idea. Does that clear things up for you, Wilbur? Wow, I really thought those cartoony drawings would hold his attention. I hope the rest of you were able to stay awake. And I hope now you understand why it takes more than just toothbrushing to control periodontal disease. Remember, the information that I provide should only be used as a guide and is no substitute for a visit to your dentist office. If you have any other dental topics you'd like me to cover, just post them in the comments below. You can find me by looking for Caire DDS, that's RCAIREDDS, here on YouTube or on Facebook, Instagram, Twitter, and TikTok. Or you can email me at rcaredds@gmail.com. And please remember to like, follow, share, and subscribe. It really makes a difference. Subscribing is easy. Just press the button down below. And we'll see you next Tuesday.